Hello and welcome to my Week 4 assignment, Healthcare Insurance Programs. For this assignment, I will be discussing current healthcare programs such as the Affordable Healthcare Act and diagnostic-related groupings that provide access and affordable healthcare insurance to consumers. I will also be describing HMOs, PPOs, and POSs, as well as private insurance plans and how they impact healthcare spending in the United States. The healthcare delivery system in the United States is made up of health practitioners, agencies, and organizations, all of which share a common goal of delivering quality care. The largest area of care provided is in doctors' offices and private clinics by physicians who sell their services. Most residents have health insurance pay for their medical services through a third-party company. These third-party companies can be governmental or non-governmental, otherwise known as private. Third-party payers pay a portion of the patient's medical bill for medical services, treatment, and medications provided by a healthcare organization for reimbursement. These third-party payers provide access and affordable healthcare insurance to consumers. With healthcare costs rising rapidly, patients cannot pay for services themselves and rely on their third-party health insurance to reduce the total amount of their bill. A third-party payer can be considered anyone who pays for healthcare other than the patient themselves. Governmental organizations are large insurance companies like Medicare. Non-governmental organizations are private health insurance companies or employer-based self-insurance like Blue Cross Blue Shield. Each third-party payer will pay a portion of the medical bill, so the responsibility is not solely on the patient. The organization and payer will produce a way for the bill to be paid by the third party, whether it be in full or through a payment plan, negotiating the price with each case varying. Private or non-governmental is a third-party payer that an individual privately pays for or receives through their employer. In the United States, the most common type of health insurance is privately offered through an employer. There is also private health insurance that you can individually purchase without assistance from an employer, with the largest being Blue Cross Blue Shield. Blue Cross Blue Shield's plan covers medical services in the hospital and outpatient or primary care. The plans vary state by state and have a variety of additions such as dental. In 2017, 153 million non-elderly people had private employer-sponsored health coverage. Typically, employers pay most of the premium on behalf of employees and their dependents. These individuals pay a premium each month to remain covered, and the insurance companies compensate the providers. In exchange, the insurance company pays the rest of the bill up to the agreed-upon price. This arrangement allows for payment of services without the responsibility solely on the patient, and proper reimbursement can take place. Not all plans are available in every state, and Blue Cross Blue Shield itself is only offered in 47 states. Some available plans are HMO and PPO. As Blue Cross Blue Shield comprises 35 different companies, benefits can differ in each state or area. Some pros and cons of this health insurance are it is a reputable company with a nationwide presence, multiple types with $0 deductibles and premiums, and extra benefits like vision and dental. Some cons are not being available in every state. It can be hard to find information, and there's below average customer service. There are three basic types of managed care plans: health maintenance organizations or HMOs, preferred provider organizations or PPOs, and point of service plans or POSs. All managed care plans have an arrangement between the insurance company and a specific network of doctors or hospitals. HMOs provide medical treatment on a prepaid basis, which means that HMO members pay a fixed monthly fee, regardless of how much medical care is needed in a given month. HMOs provide a wide variety of medical services, from office visits to hospitalization and surgery. Members receive treatment from providers only in their network. A PPO is made up of doctors or hospitals that provide medical service only to a specific group or association. Rather than prepaying for medical care, PPO members pay for services as they are rendered. A point-of-service plan is a type of managed healthcare system where you pay no deductible and usually a small co-payment when you use a healthcare provider inside your network. The member chooses a primary care physician who is responsible for all referrals to doctors or hospitals within the POS network. Usually, an employer or insurance company will reimburse the member for the cost of treatment. The physician may submit the bill directly to the insurance company for payment. The insurer then pays the covered amount directly to the healthcare provider, and the member pays his or her copayment amount. If you choose a doctor or hospital outside of network, then there is a pretty costly deductible. Diagnostic-related groups are a way that insurance companies organize hospitalization costs and determine how much the patient should pay. DRGs are based on the principal diagnosis, secondary diagnosis, surgical procedures, age, sex, and discharge status of the patient. If the hospital spends less than the DRG payment on your treatment, it makes a profit. If it spends more than the DRG payment treating you, it loses money. In the DRG system, the insurance pays for a procedure or diagnosis rather than the number of days the patient has stayed in the hospital. Diagnosis-related groups are the most important cost control and quality improvement tool that governments and private businesses have implemented. Since the introduction of DRGs in the early 1980s, the healthcare system has developed an increased demand for this new system that can serve its objective more efficiently. Through DRGs, hospital can gain an understanding of the patients being treated, the costs incurred, and within reasonable limits, the services expected to be required. DRGs encourage hospitals to become more efficient in treating patients and take away the incentive for hospitals to overtreat patients. It is also important to mention that as hospitals are becoming more eager to discharge patients as soon as possible, sometimes patients are discharged home before they're healthy enough. There have been many errors and fraudulent activity before DRGs were implemented. Inaccurate billing and coding can affect the hospital's reimbursement through serious fines and penalties. When used correctly, DRGs can help improve healthcare costs and improve the quality of care. The Affordable Care Act was enacted in March of 2010, otherwise known as Obamacare. This law has three major goals. To make affordable health insurance available to more people, the law provides consumers with subsidies, premium tax credits that lower costs for households with incomes between 100% and 400% of the federal poverty level. To expand the Medicare program to cover all adults with income below 138% of the federal poverty level, and not all states have expanded their Medicaid programs yet. And also to support innovative medical care delivery methods designed to lower the cost of healthcare generally. The Affordable Care Act intends to expand access to insurance, increase consumer protections, emphasize prevention and wellness, improve quality and system performance, expand the health workforce, and curb rising healthcare costs. And then this is an image I found that said that they predicted 30 million people would gain insurance through the Affordable Care Act by 2020. 2/3 of people would be covered through the new health insurance exchanges, and 1/3 would be covered through Medicaid expansion. This was an accurate prediction, as in 2022 they reached 35 million people who were covered. And these were the references I used. Thank you for taking the time to listen to my project.